All right. Hello, everyone. I hope you're all doing well. I'd like to welcome you all to the 11th episode of the Journey to Healthcare. And today we have a really exciting episode. The title is Emergency Paediatrics, and we have Dr. Karl here with us. Yes. So, Dr. Karl, would you like to introduce yourself, please?
My name's Karl. I'm a pediatric emergency specialist and pediatrician who works in Sydney. And I work in a tertiary pediatric hospital, the biggest in the state. And specifically, I work in the pediatric emergency department in this pediatric hospital, which is the biggest and busiest of the state. As a hospital, we are a pediatric hospital. We are the trauma center, the burn center, the transplant center, and we have a lot of all the pediatric specialties within our hospital. So I'm very much interested in pediatric emergency medicine. That is my field and is my passion. But I'm really interested and passionate about teaching also.
Brilliant. So I'll ask you a very classic question. Why medicine?
Why medicine? My answer back would be, why not? Medicine is a wonderful field to get into. It's a very fulfilling but challenging career. Personally, for me, medicine is more than just a career. It's a real vocation for me, a real calling. And I think for me, the heart of it is the opportunity to help others, to serve others through medicine. So I think for me, that's probably the core thing which people should consider if they're passionate about helping people. And within the field of medicine, it's about using our intellect and reason to solve medical problems, gather the resources within the community of experts that we work in, and also the research out there to provide the best sort of medical or surgical management for the patients that we care of. So I think those are two important things. The other thing about medicine is medicine, particularly in pediatrics and emergency, it's a very sort of patient-centered field where like the interaction between the patient and families is critical. So if you enjoy dealing with all different types of people, then this is a field that you could consider. And medicine is challenging and it will push you to grow. So there's another aspect of why, if you're interested in medicine, you should consider.
Yeah, I completely agree. I think as challenging as it is, it's equally rewarding. So this is what keeps you motivated, to keep going on. So you mentioned.
I completely agree.
Yeah.
And I think in terms of variety, there's never a dull moment in medicine, particularly emergency medicine. It's always something different, something new, something exciting.
Yeah, exactly. It's very rare that the field will stagnate. There's always something going on, as you mentioned. So why pediatrics emergency? What got you interested in the field?
Well, I was initially interested in pediatrics. I think working with children and families was, particularly with children, of all different ages, was really attractive for me. I was sort of interested in it when I was in medical school, but then working as a doctor and doing things like volunteering overseas, like in East Timor or Africa and Zambia or Peru, working with children really ignited my passion for working with children and families. And I think working with children keeps you young because you need to be friendly, you need to be approachable, and children are real, so you have to be real and authentic back to them also. So a lot of these things made me choose pediatrics. It's hard to pinpoint a specific reason why pediatrics. It's like, why do you love your best friend? There's so many reasons. I can't pick one. I'm just thinking whatever that comes to my head, I'm just giving to you now. But primarily working with kids and family, they are a vulnerable group of people. and they require specific expertise and help.
Yeah, and I think for me personally, the fact that they have a changing physiology that's quite rapid, I think that is quite interesting in the like medicine of pediatrics. So yeah.
Yes, the variety, because we take care of children from 0 to here up to 16 years old, and so there's a whole spectrum of developmental stages, which is really interesting. And so as a clinician, you need to be aware of the changes in a child's physiology and pathophysiology as they move through the years of their life, and also your approach to the child depending on the developmental age. You need to tailor it, so that makes it quite exciting and interesting.
Yeah, absolutely. So, take you a bit back. So, talking about med school, what was your favorite part of med school?
Oh, that's a good question. Med school was quite a long time ago, so that was probably just over 10 years ago. I was in my final year. But medical school, let's see. I think the clinical doing my clinical rotations was the most exciting bit. The theory and stuff was good, and learning and studying, that was great to gain knowledge. But then actually talking to a patient, seeing what's happening with them, and then applying that knowledge that you've learned theoretically to see how that fits in the clinical picture, that was really exciting for me. So I wasn't so I definitely loved my pediatric rotation when I did medical school. That was my favorite rotation. So if I had a favorite thing, that would be it. The other things, when I remember back, is back in medical school, it was just mainly about studying and passing your exams. I didn't have too much responsibility, so I really enjoyed myself. Then had a lot of friends, and trying to keep a balance in life was an enjoyable part of medicine.
Yeah, okay, then that means I should try to enjoy it more, because I hear that once you graduate, things will get easier, but I don't think that
No, I think that you have different challenges, and so that's how you approach that challenge. And now I'm a pretty optimistic guy. I always reflect back in my past and I tend to think about the positive things. It is challenging, med school. It is stressful, but then you just got to appreciate that stage of your life, and look out for the good things.
All right. Yeah, absolutely. So, right in the beginning, when you enter med school, you have like one specialty in mind, and the stereotype, everyone want to be a neurosurgeon.
Yeah.
Med school. I was one of them.
Yeah.
So, what was your specialty right in the beginning that you thought you would become when first year student?
To be honest, Mama, I was just happy to get into medical school. And for me, just coming from a sort of humble background, medicine was never within my sights until I started to do university. So I went to medical school in the University of Sydney, which is a postgraduate degree. So when I first started, I thought I was going to be a scientist. So I did medical sciences, which helped me with medicine afterwards. But I was happy just to get into medicine, knowing that I'll be a doctor one day. And I didn't have a specialty in mind at the beginning. I was just really open to see what will come out of my medical degree and what interest will I develop. So at the very beginning, the first 2, 3, maybe even the 4th year before I did my pediatric specialty, I really didn't have any specialty in mind. I was just happy to learn medicine. And yeah, I think the last year was when after done my pediatric rotation, I was like, oh yeah, I think I really like this specialty, but I still wasn't 100% then. So I didn't have a specialty in mind. I was just happy to be within the course.
Yeah, I think that's very, very important, because it's really good to be completely open-minded. Some people will be like, okay, I'm going to be this, and then they don't give themselves a chance to explore the other options, which they might enjoy more actually. But yes, I think being open-minded is very, very important.
Yeah, and I think what you'll find when you move into your career, like this, I think sometimes the specialty chooses you. For example, it depends on like what rotations you go through, the type of people that you meet. Like for me, when I met pediatricians, I was really attracted to them. They were very inspirational to me. So the teams that you work with and the clinical cases as well that you come across will sort of determine where you go. For me, when I was a junior doctor, I had a lot of acute cases, and sort of I built up my interest and strength just because I had very significant pediatric cases that I had to deal with early on in my career.
Yeah.
So yeah, there's a lot of factors that sort of, I think in the end, pushes you towards which career you take up.
Yeah, absolutely. So now how long does it usually take for someone to train and then in pediatric emergency?
So here in Sydney, I'm not sure what it's like there in Oman in terms of training. So I did a postgraduate degree in medicine, which takes about 4 years. Okay. Once you graduate, you're officially titled a doctor, and you work 2 years as an intern and resident. And as an intern and resident, you will be rotating between all different specialties: surgical, emergency, general medicine, all the subspecialties. So that's within the first 2 years of your doctor career. And then afterwards, then you start choosing which specialties you want to go into, whether it's surgery, emergency, medical specialties. I chose pediatrics then. So all in all, because I did a dual specialty in pediatrics and pediatric emergency medicine, it took me about 9 to 10 years of training from graduation. So it's quite a long time, but it's gone really quickly. And I can still remember being in medical school, and sometimes I have to check myself like, wow, I'm a full-fledged staff specialist now. Like it only feels like yesterday when I was still learning how to do all these the simple pathophysiology and simple things. But now, yeah, things will move very quickly for you guys once you graduate. Trust me.
Time surely passes quickly. So I think there are some people who may be put off by the duration of training post-med school. But as you said, I mean, time will pass anyway. So why don't you pursue something that you enjoy without focusing too much on the time aspect? Even entering med school, many people get worried like, oh, it's longer than other degrees and things like that, especially when you have to do a postgraduate or like 6 years other than 4 years. So yeah, I think time will pass anyway. So just why not spend it doing the things that you actually love and have passion for?
Yes, I think you hit the nail on the head. Just choose something that you really love, that keeps you interested, and that you're passionate about. Because if you continue to do that, then the challenges sort of will be secondary to the fulfillment you get from working and training in that specialty. For me, that was pediatric emergency medicine.
Yeah, absolutely. Okay, so currently right now, what's your typical day like? I can imagine it does vary, but like on an average day, how does it look like?
Okay, so I'll start with an average week. So in my job, we do shift work, but when you're a specialist, at the moment, I don't do any night shifts. I do usually a day shift, which goes for 10 hours, or an evening shift, which goes again for 10 hours. Usually, so the day shift will be from 8 to 6 p.m. and an evening shift will be from 2 p.m. to 12 midnight. And typically I would do 3 day shifts a week and 1 evening. So it's 48 hours or something like that I do typically in a week. So a day shift, yeah, we start in the morning, we get handover, we see the patients that have still remained overnight, and then we get patients throughout the day. And it's interesting with pediatric emergency medicine, there's usually the busiest times are usually the afternoons and evenings. So usually after school, there'll be like what we call a busload of children that they were okay at school, but now they're looking a bit sick. They've come home. They'll come to us, and there's usually another peak after dinner. So it's funny. Like usually during the weeks, the weekdays, that's what happens. Weekends, it can be busy throughout the day. We tend to have more sort of injuries because children are playing around in the park. So so that's a typical day shift. An evening shift, yeah, again from 2 to midnight, usually probably the busiest part of the day. In my specialty, because I do a lot of teaching as well. So some days are just dedicated to non-clinical things, and a lot of the time that I spend is teaching junior doctors, medical students, and also the nurses and like that within my department. So yeah, every day is a little bit different, but that's generally how it runs.
Yeah, I love the variation that between teaching and clinical work. I think that is something quite interesting. Yeah. Right.
Yeah. I think there's a lot of value, particularly in emergency medicine, because a lot of trainees will rotate to the emergency department. So, and I mean, one of the challenges as an educator is how do you teach in such a busy, crazy environment? So a lot of the teaching that we do is opportunistic teaching, or teaching on the run while we see patients, while we do handover. So there's a lot of teaching actually that goes on during the course of the day.
I could imagine that. So now there's always a good side of thing, and then there might be like the less good side of things. So what would you say your least favorite thing about emergency pediatrics?
My least favorite thing? Well, I think the hardest thing, and probably my least favorite thing to do, is giving bad news. So we give bad news when we sometimes we will diagnose a serious illness like cancer in a child, and giving that bad news to the child and to the parent is probably one of the most difficult things to do in pediatric emergency or emergency in general. So I think it's not my least favorite thing to do. I think it's a very important part of what I do in terms of providing that information in a sensitive way, but it's one of the hardest things to do. And one of the hardest things to do is just say, we do get children who pass away in the emergency department despite resuscitation, because they come in very, very unwell and very, very sick. So breaking that news to the parents when we stop resuscitation is probably one of the hardest things to do within my specialty.
Yeah, I could imagine that is really difficult, and I think it requires a lot of skills, because you're not only dealing with the patient, you're also dealing with the parents, and yeah, it must be very, very challenging.
Very, very challenging, but it's part and parcel of what we do. But in general, it's an amazing specialty.
So do you have like an average number of patients you see per day or per week, or does it differ, like completely different each day?
It varies a lot, and particularly with these COVID times, the presentations, it's really unpredictable. Like when we were in lockdown, our presentations almost halved, but now we've coming out of lockdown, the presentations are increasing. But if I can take some sort of general stats before the COVID hit, we are a busy department, so we would see 200 plus patients a day, and the highest would be like 240 upwards. So that's a typical day before this whole lockdown was maybe close to 200 per day. So it gets pretty busy. we do see a lot of children and family per day, and then you can extrapolate that to what a year would be, and that would be more than 60,000 children and families per year that comes through our doors.
Yeah, you must be a very, very busy department indeed. Because usually
Busy
I
department.
always, yeah, I always hear like, oh, I see 30 to 40 patients, but 200 is
Yeah,
indeed.
not I don't see 200 patients personally a day, but the department does. Yeah,
Yeah.
that's a lot. Yeah, it does get busy, but that's part of it.
Yeah. So, in the specialty, is there like a common procedure you do, or like what are the procedures you do as a pediatric emergency physician?
Oh, so the good thing about pediatric emergency medicine is we get the whole breadth of pediatrics coming through our door, right? And so we do a lot of procedures, common things like your simple cannulas, your nasogastric tube, your urinary catheters. So those are basic things that we do. We do lumbar punctures, pediatric lumbar punctures, and then there's a lot of procedures that we can do. We do procedural sedation, for example, using heavier duty drugs like ketamine, intubation for the children who require ventilation. We sometimes put chest drains in for the traumas that come our way that require, like the pneumothorax or hemothorax from a trauma, putting chest drains in. We do nerve blocks, for example, the femoral nerve blocks or fascial blocks for children with femur. So there's a whole range of procedures that we do within the emergency department. And that's what's one of the other things which makes pediatric emergency medicine fun. There is a lot of technical stuff that you are able to do within our department.
Oh, that's really interesting. So, what advice would you give someone who is aspiring to be a pediatric emergency physician in the future?
What would I aspire? I would recommend that, first of all, develop your pediatric skills. That's going to carry a lot of weight when you do pediatric emergency medicine. First of all, you need to understand children in terms of their pathophysiology, their development, how they fit in the family, and you need to be, in terms of the craft and art of pediatrics, you need to be able to relate with them, talk to them, be able to examine them if they can't speak or if they're non-compliant. You need to be able to take a history and examination with a child as your patient. So I think that's really important, to have a good pediatric foundation. To do that, I'm not sure what it's like there in Oman, but just doing pediatric terms is important. If you're interested in acute care pediatrics, then doing emergency terms, I don't know if you have mixed emergency departments or pediatric ICU or neonatal ICU, there would be terms which I think will be useful if you wanted to become a pediatric emergency specialist, because like I said, anything walks through the door, so you have to be prepared to manage that, and I think finding someone, a mentor who's in the field just to help you out would be another important step towards this career. I think that's the main things. Other things is there are courses out there online that you can do to bolster your understanding of pediatrics. One comes to mind is like Don't Forget the Bubbles. I'm not sure if you're aware. It's a UK-based sort of pediatric resources out there. Just to say, there's a lot of pediatric resources out there online, and you just have to sort of Google it. But there's some interesting ones out there that you can do.
Yeah, I think in any specialty you have to prepare yourself, get like the extra skills that like are required only for that, because each one has its own specific requirement, I could imagine. So
That's right. So that reminds me, so doing like a pediatric life support or advanced pediatric life support would be like, if there's wherever you're available, there it was ones available, they're always good to go to, or like a neonatal life support sort of things. There will be some things to get under your belt early on in your career if you're really interested in pediatric emergency.
Yeah. Nice. So I would like to thank you so much for this really insightful interview. Though it's on Zoom, but whatever. And
Yeah.
I've learned quite a lot, and it got me more and more excited in the field of pediatrics. So
Cool.
Thank you so much for being here. Do you have any closing message you would like to say, or?
Yeah. So first of all, thanks, Yamama, for inviting me to this interview. I think it's great to connect with people worldwide. I think it was one of the advantages of social media like Instagram, and that's why when I'm interested in education, I've been experimenting with Instagram, and I'm pleased with what's happening. In terms of take-home messages, pediatric emergency medicine is an exciting specialty. You do see the breadth and range of pediatrics coming into the door, and you need to be able to have an approach to all these different things. So there's never a dull moment within this specialty. You've got to use your clinical mind to figure out problems. There's a lot of technical skills that you need to develop over time. And the great thing is you're always dealing with children and families throughout your career. So never a dull moment in pediatric emergency medicine. So consider it. In terms of medicine in general, like you said before, Yamama, you need to. This is not a race that you're in. It's a long-term career. So find that specialty that you're really passionate about, that sort of wakes you up in the morning and gets you going. Once you find that, then I think that's probably the right specialty, and then just pursue it with all your strength and heart.
Yeah.
That's my final remarks.
Absolutely brilliant. Thank you so much for being here, and
Yep.
I really appreciate you accepting this invite, and I wish you all the best. And oh, by the way, Dr. Karl's Instagram, it's really informative. He does educational posts. I like the ones where there was a series about bone fractures, and yeah. So if you are interested in, getting educated on the go, I think you should check his Instagram account. I will, of course.
Thanks. Yeah. Thanks, Mama. All the best with your studies. Yeah, I wish you luck, and keep in touch.
Of course. Thank you so much, and I wish you have a good day.
You too.